Welcome to the MEDI382 clinic, specifically for tuberculosis. I'm Bryce, and this is my assistant Timothy. What can I do for you today? Oh, you think you have tuberculosis? You've come to the right place. Let's have a look at your symptoms and see if they match our usual descriptors. These are a cough lasting longer than 3 weeks that is not improving, blood-stained sputum, fevers, night sweats, unexplained weight loss, if you always have a feeling of being tired, have a loss of appetite, and if it's in the extrapulmonary region, if you have pain or swelling in the affected area. Okay, I think we should do some tests just to confirm this. TB is usually found in the lungs, where it's called pulmonary TB. So I'll need a chest x-ray and a sputum test to confirm this. If you have swelling and pain outside of the lungs, this may be what we call extrapulmonary TB. We'll need more analysis from a fine needle biopsy, wound swab, or a urine sample. Extrapulmonary TB is prevalent in approximately 15% of cases, and that's where it has spread in an extrapulmonary fashion outside of your lungs. This may be to the pleural cavity, the central nervous system, the lymphatic system, the genitourinary system, or the bones and joints. If it has spread outside the lungs, it is most commonly found in the lymphatic system. Speaking of likelihood, let's have a look at some of the statistics.
We can see, however, that some countries, such as the Philippines, have a much higher incidence of TB, which is greater than 500 people per 100,000. We're going to have a look, obviously, at our country, Australia, which here is very, very low, less than 10 people per 100,000. Historically, it has been quite deadly. You can see here from this snippet from the early 20th century that it was quite deadly and actually recorded deaths rather than notifications. And here we can see, more than 100, hovering just a bit under 100 people dying in these timeframes then per 100,000. You can see here that we have transitioned from deaths to notifications as vaccines and better treatments have been developed. We can also see from the information that the average notification rate is about 5.7 cases per 100,000 of the population. Also, some of the other figures particular to Australia is our indigenous rate of the disease, which is approximately equivalent. 5.8 is the literature per 100,000.
So you may be asking yourself, if that's the incidence of the disease and where it's found, how do I get it? Well, TB, or tuberculosis, is caused by the infection of the host person by a bacteria called mycobacterium tuberculosis. The bacterium is easily spread as an aerosol by coughing and sneezing. It can appear in the droplets that you breathe out. Simply breathing in that air containing the bacterium can infect a person. Now, while technically more people have TB than HIV, it's usually found in a latent capacity, meaning that it won't be spread by that individual because the bacterium is contained in the lungs. The mycobacterium tuberculosis bacterium infects the patient. The waxy membrane of the bacteria evades capture by the cilia and mucous membranes of the trachea and manages to reach the lower levels of the lung tissue. The bacterium is foreign to the body and is detected by macrophages under normal conditions, at which point it is engulfed and ready for phagocytosis, breaking down. However, the mycobacterium tuberculosis produces chemical agents that prevent this process, that stops the lysosome fusion with the phagosome which contains this bacterium, preventing phagocytosis. So now that it has survived destruction, it can replicate and grow and infect your tissue. However, the body recognises this and attempts to isolate the bacterium through creating a barricade of macrophage cells, forming what's called a granuloma. The granuloma is made to contain the spread of any foreign body, but in this case, it is the tuberculosis bacterium. It may not always cause tissue death, but in this case, it usually does result in necrosis. When it's contained in this way, it is still said to be latent. It cannot be spread. However, TB may not always be contained and may break away from the granuloma, especially if the patient has a weakened immune system, if they're pregnant, if they attain HIV, diabetes, or kidney damage, etc. Now it is active and may begin showing more severe symptoms than it would previously, whereas the latent form was asymptomatic. Now that it's active, it may present as more severe flu-like symptoms and a persistent cough, with increasing damage over time. So far it has been presented as in the pulmonary capacity in the lungs. However, once it begins to spread, it can also spread around the body, and when it does so, it is called extrapulmonary tuberculosis, affecting around 15% of patients. The extrapulmonary tuberculosis may reduce oxygen supply to those areas and result in decreased ability to function, such as central nervous system damage resulting in meningitis, inflammation of the brain. TB is preventable with a vaccine, first developed by Robert Koch in 1890. Remote communities and developing countries with limited vaccine availability still have presentations of TB that can be treated. TB is treated with antibiotics such as isoniazid, rifampicin, ethambutol, and pyrazidine.